Hello everyone, welcome back to MedLab Insights. In today's video, we'll be guiding you through the lipid profile test. We'll cover what the lipid profile is, how patients should prepare, the methodology of the test, proper sample handling and storage, how to interpret lipid profile results, and the significance of these results to health and illness. Let's begin with an overview of what the lipid profile test actually is. So, a lipid profile test, also known as a lipid panel, is primarily used to assess the risk of cardiovascular diseases, such as heart disease and stroke. It helps healthcare providers evaluate the levels of different types of fats in the blood, which can indicate how well the body is managing cholesterol and other fats. So now that we know what a lipid profile is, let's get straight into the video.
Patient preparation for the lipid profile test. Patients should not eat between 9 to 12 hours before the test. If you accidentally break your fast, please inform your healthcare provider. Patients are required to have a stable diet for 2 to 3 weeks before the test. Make sure your healthcare provider knows the medications you are taking, including the over-counter supplements. The healthcare provider will inform you if you need to stop taking those supplements before the test. If you have any symptoms or have any family history of any illness, please ensure to inform your doctor before the test.
My name is Bethanie Johnson and I will be explaining the methodology of the lipid test. So firstly, we have the patient and we also have the healthcare provider. The healthcare provider will gather materials such as the alcohol cotton swab, the needle holder, band-aid, non-sterile gloves. The patient and the healthcare provider will be seated on the same level. The healthcare provider will tell the patient to extend their left arm. The healthcare provider will then locate the cubital fossa to identify the antecubital vein so that the blood can be drawn using the venipuncture method. 3 to 5 milliliters of blood will be extracted. When that blood is extracted, the blood will be transferred into the red top tube or the laboratory tube that the healthcare provider had gathered initially. The tube will then be labeled with the patient's name and the date that the blood is extracted, and also the blood is then allowed to clot for 20 to 30 minutes. Significance of allowing the blood to clot is that it prevents lipid degradation that would affect the ending results of the experiment that aims to determine the heart assessed risk of the patient. The serum is then sent to the laboratory where the test is done. The main equipment used is the automated chemistry analyzer. An automated chemistry analyzer is a laboratory equipment that is used to perform many chemical tests on blood, serum, plasma, also body fluid, but as it relates to the lipid test specifically, is used to assess serum from blood plasma. The main steps are the serum is loaded into the automated chemistry analyzer, and then specific enzymatic reagents are added to calculate values of cholesterol and also LDL, HDL, and triglyceride. The values obtained are used to determine the patient's heart assessed risk based on the values obtained from the LDL and HDL.
So now I'll be walking you through how we actually handle samples, because the way we collect and process samples can completely affect the results. So for a lipid profile test, the ideal specimen is serum. That means if we're using a red top tube like this one, then we have to allow the blood to clot completely before we do anything else. Plasma can also be used, usually from a lithium heparin green top tube, but of course, serum is still preferred for the most accurate results. After the blood is collected, we need to separate the serum or plasma within 45 minutes. The gel barrier tubes would also be helpful because once they're spun, then the gel automatically separates the serum or plasma from the cells. Now, once the sample is separated, it needs to get to the lab quickly. ideally within an hour, because longer transport times can cause lipids to change and of course lead to inaccurate results. Light exposure can also break down certain components of the sample. So when needed, they are transported in amber tubes. If you don't have amber tubes, just simply wrap them in foil. You don't have aluminum foil, just get a little thing and you wrap the sample. Just it's simple, but it's simply just to shield it from the light or not getting that much exposure. Now, this part is very important. If the sample cannot be tested right away, then we need storage. If the sample is at room temperature, then the sample needs to be tested right away. If we refrigerate the sample between 2 and 8 degrees Celsius, then we can get about 2 to 3 days of stability out of the sample. And if we freeze the sample at about negative 20 degrees Celsius, then the sample is stable for up to 2 weeks or even a month. One thing to avoid is multiple freeze-thaw cycles. A maximum of 2 cycles is recommended because every time you thaw and refreeze, the lipids get damaged. Now I'll show you some tubes you should most definitely not use for a lipid profile. So first we have this purple top tube, and this contains EDTA, ethylene diamine tetracetic acid, and this actually prevents the blood from clotting, which is what we don't want because we actually want the blood to clot. Next we have this blue top tube, and it contains sodium citrate, which can also affect lipid measurements. So this one is also not suitable for a lipid profile test. And finally, this gray top tube, it contains fluoride, which is mainly for glucose testing. So of course, this is also not suitable for a lipid profile test. So really, for lipid profile testing, the red top tube like the one I have here, the gel barrier tube, and the lithium heparin green top tubes are the best choices for lipid testing. Just to ensure you get the most accurate results and nothing is altered, nothing is messed up. And finally, we prevent hemolysis, so we don't shake the tubes or expose it to extreme temperatures before separation. I'll now hand over to our next presenter.
So let's begin. We'll cover two main parts. First, the individual cholesterol numbers, and second, the important risk ratios. So, the main players, the good, the bad, and the troublesome. So, think of your bloodstream as a complex highway system. Different types of fats and proteins are traveling on it, and we need to know who the good and the bad drivers are. So, first up, the bad guys, the bad drivers. So, LDL cholesterol, or I like to call it the lousy cholesterol. This is the main troublemaker. So, imagine the LDL as a fleet of dump trucks. Their job is to deliver cholesterol to your body cells. But when there are too many dump trucks, they start dropping their load, creating fatty plaques that clog and harden your arteries. This is a major risk factor for heart attacks and strokes. So for LDL, a lower number is better. Ideally, you'd want it under 100 milligrams per deciliter. Let's move on. Triglycerides, the troublesome fat. These are the most common type of fat in your body. They come from the food you eat, especially sugars and refined carbohydrates. High levels of triglyceride can make your blood thick and sludgy, which also damages your arteries and can inflame your pancreas. So for triglycerides, a lower number is better. You'd want them under 150 milligrams per deciliter. And then finally, we have the VLDL, the very lousy cousin. The VLDL is like the LDL's less famous but equally problematic relative. Its main job is to carry those triglycerides around. So if your triglycerides are high, your VLDL is usually high too. It's another bad cholesterol you want to keep in check. Again, lower is better. So aim for under 30 milligrams per deciliter. And to further prove that VLDL usually are typically higher when triglycerides are higher, The calculation for VLDL is usually dividing your triglycerides by 5, and you'll get the number of VLDL. So now let's meet the heroes, or the good drivers. So that's your HDL cholesterol, or the healthy or hero cholesterol. So think of the HDL as the cleanup crew or the garbage trucks of your bloodstream. They cruise around, scoop up the excess bad drivers or bad cholesterol from your artery walls and carry it back to your liver to be removed from your body. So this is the one where a higher number is better. It's protective and will keep you safe. So you want your HDL to be at least 40 milligrams per deciliter, and the higher, the better. So finally, the big picture, the total cholesterol. This is the overall sum of all the cholesterol in your blood, the good, the bad, and the troublesome. While it gives a general overview, the breakdown into LDL and HDL is much more important. So a desirable level is under 200 milligrams per deciliter. So let's move on to part two of this segment, the big picture, or the risk ratios. So now that we know the players, the most powerful insight comes from looking at how they balance each other out. This is what the risk ratios do. They tell us if the good team is powerful enough to handle the bad team. So, firstly, we have the cholesterol and HDL ratio. This ratio asks, is my good cholesterol strong enough to manage the total amount of cholesterol in my system? A low ratio is good, and this means your cleanup crew is robust and effective. A desirable low risk ratio is less than 4. Let's move on to the next ratio, the LDL and HDL ratio. So this is the bad cholesterol divided by the good cholesterol. This is an even more direct matchup. It's likely asking, for every one of my good HDL garbage trucks, how many bad LDL dump trucks are there on the road? Again, a low ratio is what we want, so a low risk ratio here is less than 2. So, to bring it all together, here's a simple way to remember it. You want your LDL to be low, so the lousy cholesterol to be low, and you want your HDL to be high. Your healthy cholesterol, or I like to call it the hero cholesterol. And the main goal is to have a strong cleanup crew and minimal clog causing traffic on your arterial highway. And the ratios help to confirm that this balance is in your favor.
Why is the lipid test so important? A lipid test, or also known as a lipid panel, is necessary because it measures the levels of fats in the blood, mainly cholesterol and triglycerides, which are key indicators of the risk of heart disease, stroke, and other cardiac problems. Significance of results to health and illness. So when we do these lipid profile tests, it is significant to our health and also illnesses that we may have, because they detect high cholesterol early. So once you do these tests, you're able to see if it is that there is an abundance of LDL, which is low density lipoprotein in the blood, which can be bad for you and cause problems such as osteosclerosis, which is hardening of the artery walls. Also, you can assess the risk of heart disease and stroke. So once it is that you do the test, you can also see whether or not you have high density lipoprotein in the blood in an abundance. And with that being the case, then you know you may be at risk for stroke or having a heart disease. Also, you are able to monitor treatment effectiveness. So if it is that you're on certain medications, once it is that you do this lipid profile test, you are able to see whether or not the medications are working to either increase your cholesterol or triglyceride levels, or lower, especially lower the triglycerides and cholesterol levels. It also identifies genetic disorders. Conditions like familial hypercholesterolemia can cause a very high cholesterol and require early treatment. tests can help diagnose whether or not you have this condition present. Also, it is a part of routine health checkup. It should be a part of your routine health checkup, I may add. Many guidelines, they recommend that healthy persons do these tests every 4 to 6 years, and for persons who are at risk, they should do these tests more often to ensure that their levels are in accordance. There are certain factors that contribute to you having out of range readings. For example, lifestyle and behavior. So if one is not eating properly, they're not taking care of their diet, they're not maintaining their weight, they're drinking alcohol, smoking constantly as well, and they do not have a lot of physical activity being done during their daily life, then you know you may be at risk for having an out of range reading once it is that you do this test. Also, there are certain pre-test factors that should also be done prior to you going in to your healthcare provider to have this test done. Some of these factors include having a fast. So you should definitely fast before you go in, because when you eat and the food contains fat and it's not absorbed through the blood, then you know this will be present and show that you have a higher amount of cholesterol or triglyceride levels, and that will make the reading inaccurate. Also, you shouldn't be doing any strenuous activity or exercise prior to you going into the test. So you know you cannot be going to the gym the morning off, so because that will cause you to have a higher reading showing up once this test is completed. Also, there are medical conditions that can cause you to have an out of range reading as well. For example, persons that are diabetic, they have hypertension, they have chronic kidney disease, pregnant persons who have been diagnosed with having the polycystic ovarian syndrome, PCOS, those are for females. When they do this test, it definitely will show up that they have a higher lipid profile range there. We also have persons who may be on certain medications. Certain medications will definitely provide an inaccurate reading. These can be from persons being on diuretics or any type of blood pressure medication, or some types actually of blood pressure medications, some HIV medications as well, and also oral contraceptives. These may provide an inaccurate reading once the test is done. There are also certain factors that we're unable to control because this happens naturally, and these factors are genetic. So genes that you'd have been born with, that you'd have earned from your parents, then you know for those genes there's nothing that you can do to change it. And with this being, if it's not being accurate, then there may be a case where you may have an off or out of range reading. Also, based on your age, the person's age, it may differ when it comes to you doing your lipid profile test. You may see your ranges being different. And also sex. So females may have a separate range versus males as well.
And that's the end of today's video. Thank you guys so much for watching. I hope you enjoyed this video as well as learned something new. See you guys next time. Bye.